Okay, so what I'm going to do quickly, guys, I'm actually going to pivot over to talk about this. It's a rather long title of the paper. We'll kind of go quickly into a science corner for those of you who are familiar, I guess not familiar with this. This is really just a way for me to kind of present some of the primary literature to you guys to understand kind of where we come from and what are some of the foundations for why neuro rehab is designed the way it is and why we make recommendations the way we do. Um, and so this paper is actually sort of it's kind of a meta paper in so far as that it is a summary of papers. And so very much like a primary source would be kind of studying maybe individual stroke survivors and how they respond to like a various type of therapy or various type of medication. But there are different types of papers that are called meta-analysis or systematic reviews. These are big fancy words that basically mean summaries of those primary sources. And the reason I bring this one up to you guys is that this is actually focusing on a component of neuro rehab that is quite important. And one of the reasons I bring this up is we often talk about the amount of rehab that you do, right? This is the concept of dosing. But I also frequently bring up this concept of the mental component of the rehab insofar as that needs to actually be active in sort of your engagement. And this paper actually kind of summarizes the current state of play, our current understanding of the importance of this idea of mental imagery and how it can actually contribute to your long-term outcomes. And so that's this concept here is what's called efficacy of motor imagery in addition to motor-based therapies. This is kind of combination approaches where you're doing motor practice, but you're also simultaneously imagining what those movements might be. And this is exceptionally important, guys, for those individuals, for those of you who are out there who may not have the ability to do volitional movement yet. So we always talk about this idea of you can't just put the Motus hand on and have it move you, right? It can certainly do that. But the important thing is you have to be imagining what those actual movements would be. And so when the Motus hand is moving you up into extension, you have to be visualizing along with those movements the actual act of you trying to do this. And so I often will encourage people to use a technique called bimanual activation, where you're actually kind of using both hands at once. And this just makes it a bit easier for you to imagine those movements. And again, the reason why this is the case that you have to do this is because the neuron in your brain that will ultimately control your paretic limb will not be turned on. And so you have to be mentally engaged in this process. And some may ask, well, why would just imagining it actually help with the actual outcome of efficacy? And that's a fair question. And truth be told, there's actually a really cool part of our motor system, the part of our brains that helps control movement. There's actually a part of it that's called kind of the mirror network. And this is a part that allows us to envision a mental practice or a motor practice. And we get very, very similar motor outcomes in the brain. So if I were to ask you to mentally practice something, your brain lights up in a very similar way to what happens when you actually do that movement. And so there's this concept early on that, hey, what if we had people just imagine doing the movements when they're not able to physically? Will that actually help them with a long-term outcome? There's been a long series of studies that have investigated this. And the present study I'm showing you right now is actually kind of summarizing that. I'll just kind of walk you through this. And there's really, the methods are quite simple, but they're very, very tedious. And what you have to do is you have to basically find every single published paper that has anything to do with this concept of using your mental imagery along with motor practice. And that's what they did, right? So they went through all the literature and they identified a whole slew of papers. Ultimately, they settled on a certain number of them, but they search out hundreds or thousands of articles, and then they sort of cull them down. They kind of reduce them down into what amounts to a summary of what our best guess of how good mental imagery, when paired with motor practice, can actually, what's the sort of best guess of what it can do. And what they do, I'll actually just kind of present the abstract here. there aren't a whole lot of really, really good randomized trials. There's a lot of non-randomized trials. We get a lot of inferences from those. But when you kind of cull it down to the best gold standard evidence, there's about 4 clinical trials at this point, randomized controlled trials. That's what RCT stands for, that actually investigated around 100 patients at this point, 100 participants. And they found that there was evidence, significant evidence, that mental imagery, this concept of using your mental abilities to envision motor practice in addition to motor practice itself, actually imparts an additive benefit to your long-term outcomes. So we don't have to go through all of the literature here in terms of what they were reporting, but fundamentally they're saying that at present, today in 2021, our best guess is that this concept of mental imagery is in fact beneficial. And so this is one of the sources that we sort of rest on for recommending this concept, recommending this practice for you guys. And I think it's especially important for those of you who don't have that ability to volitionally move yet. And so just as a kind of a take-home message for what does this mean for you guys is, so when you are using your Motus hand, it is exceptionally important for you to continue to envision those actions taking place and you yourself being the center of those actions. You're not just a passive conduit along for the ride there. You have to be actively participating. And this study really highlights the importance of that, and this will help with your long-term outcomes. So there you go, guys. That's just a quick highlight of one of sort of the background about why we make these recommendations about you got to be engaged. It's also not only the amount, but it's also the quality. This is kind of some evidence to support that the quality matters here, guys. Okay. Let me know if this was at all helpful. I'll be happy to post this paper in our live stream and in a support group and kind of give you guys a quick rundown of what it is. If you have any questions or follow-up comments about the paper, or if you want to dive into details about the methodology or some of the statistics, whatever, I'd love to get into the weeds with you guys. You know this by now. So let me know in the chat if this was helpful and if you want me to do another science corner maybe later this week. I've got plenty of studies that I could talk about. You know me, I can talk about science till I'm blue in the face. So let me know what you guys think. I'd be happy to share all of the